Breast cancer caused 670,000 deaths globally in 2022. It is the most common cancer in women in 157 countries out of 185, but it occurs in every country in the world. Treatment options for breast cancer. Surgical options for breast cancer include modified radical mastectomy, simple mastectomy, breast conservation, and nipple or skin-sparing mastectomy with reconstruction. Radiotherapy is also another form of local control. A mastectomy is a surgical procedure that involves the removal of all or part of the breast tissue, usually as a treatment for breast cancer, and it has 3 types. In a simple mastectomy, the entire breast tissue is removed, including the nipple. In a modified radical mastectomy, it involves the removal of the entire breast along with some of the lymph nodes in the armpit, or the axillary nodes. Skin-sparing and nipple-sparing mastectomy removes the breast tissue but preserves as much skin as possible, sometimes including the nipple. This is utilized to treat invasive breast cancer or reduce the risk of recurrence. Sometimes it is performed prophylactically to prevent breast cancer in high-risk individuals. Sentinel lymph node dissection uses a radioactive colloid that is injected either in the breast tissue around the primary tumor or prior biopsy site, into the area beneath the areola, or under the skin close to the primary tumor site. In the operating room, blue dye is injected either in the breast tissue or in the area beneath the areola. As the dissection of the breast continues, sentinel lymph nodes are identified using a probe or by direct visualization of blue dye in the lymph vessels or nodes. Axillary lymph node dissection is a procedure that removes lymph nodes from the area under the arm and checks for cancer spread. It remains a standard initial approach for breast cancer patients who have breast cancer that has spread into the chest wall or biopsy-proven clinically positive lymph nodes. In breast conservation, the breast cancer is removed with an envelope of normal-appearing breast tissue that is adequate to achieve a cancer-free margin, adjuvant radiation therapy, and assessment of regional lymph node status. It is currently the standard treatment for women with stage 0, 1, or 2 invasive breast cancer. Radiation therapy for breast cancer uses high-energy X-rays, protons, or particles that destroy cancer cells. All women undergoing breast conservation surgery need to receive adjuvant radiotherapy. Other indications would include more advanced cancer stages with larger tumors, involved axillary lymph nodes, or closed surgical margins. Systemic control options include chemotherapy, biologic therapy, and hormonal therapy. Chemotherapy uses drugs to kill or stop cancer cells from growing. It can be given before surgery or after to reduce recurrence risk, improving the 5-year survival rate by 30%. Chemotherapy is used when the tumor is over 1 to 2 centimeters in size and it has spread to the axillary lymph nodes. Chemotherapy is not recommended for node-negative or tumors less than 0.5 centimeters unless there are unfavorable prognostic features. Biologic or targeted therapy for HER2-positive breast cancers involves treatment specifically designed to treat the HER2 protein. Hormonal therapy is indicated for all ER/PR-positive tumors, typically after chemotherapy and radiation. Unlike chemotherapy, hormonal therapy doesn't kill cells but keeps them inactive. Tamoxifen is the most common anti-estrogen therapy, which blocks estrogen's effects. There are also newer novel treatments such as immunotherapy, PARP inhibitors, and CDK4 and 6 inhibitors.